Hello, my name is Paul Cummins. I'm here today with Professor Tom Lüscher, Editor-in-Chief of European Heart Journal. Tom, welcome. Today we celebrate the 10th anniversary of EuroIntervention. Could you tell me a little bit about the history between EuroIntervention and the European Heart Journal?
Well, first of all, happy birthday. That's quite an achievement. I had the pleasure to take over the European Heart Journal in 2009. And then at this time, I wanted to create the ESC family with manuscript transfer. And I think ever since we worked together very well, and I think both journals have their own role. The European Heart Journal is a large journal, general cardiology journal, that primarily wants to have papers that really affect practice of everybody in cardiovascular medicine to some degree. While I think EuroIntervention has more the scope of teaching people that are really in interventional cardiology on technical aspects, on how to do things and what is the outcome of different stents and so on. So I think they're very complementary, and it was really a pleasure to work with you in that time period, and we look forward to continue this in the future.
So here we're at 10 years EuroIntervention. What's your vision of medical publishing within the next 10 years? For instance, how do you see the journals developing in a digital world?
Exactly. I mean, that certainly will already has changed the landscape considerably. In the old days, there was a journal that you got every week or every 2 weeks, and initially every month. And now we have everything online. The platform is not just providing papers, it's also providing interviews, video interviews. We are twittering to actually get people attracted by novel papers we publish. The downloads now reach 6 million with our journal, so I think the access through Google mainly, but also through the platform, has become much more important than the printed version, which we print in around 20,000 copies of. So I think the electronic part has grown immensely. But of course there are people that still want to read a normal paper, have it on their desk. Yeah. Or in the CAS lab, and you know, in a break and with a coffee, just see what's in there. So I think we should offer both, but of course the importance of the printed paper versions will decrease considerably.
Okay, thank you very much for your time. Thank you.
My pleasure.